when you're going through menopause or perimenopause, your sleep becomes completely wacky. So the progesterone helps people to get a good night's sleep.
Welcome to Wellness, your ultimate guide to unlocking your full human potential through biohacking. I'm your host, Ashley Deeley. I'm a certified sports nutrition coach, former personal trainer, and Pilates instructor, and I have a degree in kinesiology. My goal is to help you improve and elevate the quality of your life. When you leave a review, it makes a positive difference. Whether you're listening on Spotify, watching on YouTube, or listening on any other streaming app, it helps listeners just like you find this hidden health information faster. America hasn't updated its beauty laws in over 80 years, and the cosmetics industry is highly unregulated, meaning harmful chemicals are hiding in your typical drugstore and big box products. But Araza Beauty is the first paleo-certified makeup line in the US, made with real ingredients you can pronounce. Their formulas are nourishing and actually good for your skin. They promote that youthful glow and high performance results. Visit arazabeauty.com/Ashley Deeley, ARAZA. That's arazabeauty.com/Ashley Deeley. Today's guest is Dr. Nonkulie Dladla, a board-certified internist and the CEO and founder of Gramercy Park Integrative. Dr. Dladla graduated from Weill Cornell Medical School and Cornell University Graduate School, earning her medical degree and graduate degree in epidemiology. She takes a holistic and functional approach to medicine, focusing on how all the body systems interrelate and impact health. Her expertise includes rebalancing the microbiome, hormonal health, and cardiovascular health and prevention using visionary Bell and Donine method. She works with both men in andropause and women in perimenopause and menopause. She uses various modalities for metabolic health and incorporates energetic diagnostic tools and treatments. She's dedicated to connecting with her patients and providing comprehensive long-term health solutions. Dr. Dladla, welcome to the show.
Thank you. My pleasure.
I have done a lot of research on you, and I always find it refreshing when someone branches out to do their own thing. For listeners hearing about you for the first time, can you please give us a bit of your background story?
So my name is Dr. Dladla, and I have been an internal medicine physician for over 20 years. I was finding that, interacting with patients, there were lots of built-in limitations in terms of how you can fully address preventative concepts like, diet, exercise, lifestyle. And in addition, I was finding that if you didn't have a very strict criteria for a diagnosis, people who had these non-specific symptoms or feelings were just kind of getting put to the side because there was not a label attached to them where you could give them a particular medication. After years of dealing with this and seeing the frustration that I was going through and the patients were going through, I decided mid-career to branch out and to have a practice really focusing on longevity and integrative medicine. I also want to say, it was also my own kind of personal health journey that kind of brought me to this point because I underwent a lot of these non-specific symptoms of fatigue and a variety of conditions that when I went to conventional doctors, I could not get a specific answer. And it was only when I kind of went out of the box and really went to naturopaths, to integrative practitioners, energy healers, that I was able to kind of put together a regimen that took me out of that kind of abyss that was quite difficult, medical school, family, many challenges. So this really, really inspired me to go in this direction.
Oh, well, thank you for sharing that. I'd love to dive in a little bit more to your symptoms or your challenges and if you were diagnosed with anything.
Yeah, definitely. So there were a few things. So I was completely exhausted, kind of facing burnout. I had a very, very hectic schedule and was just dragging through everything. And it affected not only just my physical body, but my mood. No matter how I ate, it did not really impact things. I was still feeling terrible. I did a variety of blood work, including checking my hormones, checking my electrolytes, all of these things, and it really everything came back negative. So what I did, when I went to an integrative practitioner, I was able to get a full blood panel and look to see if I had any kind of underlying viruses. And I did have Epstein-Barr virus, which is extremely common. Many of us have had mono, didn't even know we had it, thought we just had a cold or a flu. But under times of stress or duress, it can reactivate. And in my case, that is what happened. And it took really like a multidisciplinary approach to address it. It took lifestyle changes, having a strict time to go to sleep and wake up, which was difficult for me because I am a night person. Um, Also, increasing my hydration, increasing the nutrients in my diet. But I also found that I did a lot of also energy medicine, meaning I did meditation. I had Reiki practitioners work with me, and that really made a significant difference and shift. And I was kind of able to kind of get out of that cycle. So something as similar, as simple as that, Epstein-Barr virus, that could have been tested right away, but it's not something that it's always the first thing that a conventional doctor is going to look at and go and dig deep. And often people will tell you, okay, you're tired, just get some more rest. But it's often not that simple.
It's often not that simple. What was the catalyst for you opening your own practice where maybe you had had some previous limitations?
I think the catalyst was being in a rat race of trying to see patients in a very short period of time, not really being able to focus on education or underlying issues that may be causing some of their symptoms because we were so limited, and just treating, diagnoses. And after a while, it gets like, I know for myself, like I was someone who never responded well always to medication. So I needed to do a variety of different things, often natural things or out of the box types of things to be able to get my health back in order. So I wanted to be able to provide that to my patients because I felt very, very limited. The other issue is that when you're strictly in that insurance model, the insurance company is dictating what what is acceptable in terms of diagnosis and treatment and what you're going to get reimbursed for. So it's very, very, you're very limited. And everything is kind of around what those particular insurance companies believe are important or relevant for your health. So for you to get paid. So I just felt if I had more sovereignty, more freedom in working with patients the way I wanted to, being able to spend more time and offer them a variety of modalities, to be able to get them back to their original health. So I made the move, year and a half ago.
Let's go into some of the longevity modalities you offer within your clinic.
Longevity, I got interested in longevity because, we're living longer. And it's not just a matter of our lifespan, but also our health span and being able to have a high, full quality of life, even when we're older and not be dependent on a facility or our family members to care for us when we're sick and we're kind of saddled down with chronic diseases. So longevity, I believe it encompasses many, many things, and many things that I'm doing in the integrative space really also can be kind of fall into that category of longevity. So the first thing I would say is the framework or the what I kind of start with also is the mind and stress. Those things are really, really impactful in terms of our longevity. So if we have a mindset that, we will be able to kind of gather our resources, our mental, our emotional, and physical resources to push our health forward, that is the first step. And to believe that you are not confined to a diagnosis, but through balancing what I call, or what has been called, and through many ancient cultures, like the various energy bodies, you can get to a point where you're able to kind of access information before it physically impacts your body. And through accessing those energy bodies and communicating with those energy bodies through meditation, through breath work, through a variety of practices, you're able to intercept a brewing disease that can actually impact your physical body. So what I found is having these types of practices, to start with, like meditation, whatever meditation, people are aligned with, can make a significant difference in clearing out these energy bodies and get your body back into balance. I focus a lot on stress, because we are really, really impacted by stress. And even if we're eating well, we're sleeping well, if the stress in our bodies is not regulated, if we don't have a good balance between the communication of our sympathetic and our parasympathetic, we are running in a state of constant inflammation. And over time, this really, wears down your battery, it wears down your hormones, and it becomes very difficult to achieve health, even if you're doing everything right. So I talk a lot about and work with people regarding stress, because stress is something that we have to experience. It's part of life, and it's really more the body's and the mind's and the emotional ability to have resilience towards that stress. And there are things that you can do in the longevity space to help to build that resilience. So for us, it's really those foundational things. We're starting with, exercise, right? Finding the correct exercise that's customized also for you and what your ability is and your level of physical fitness. But HIIT exercise is very, very effective in regulating the body's hormones, kind of activating those particular proteins that are in favor of longevity, and removing some of the cellular debris that can build up in the system. So we really advocate that. I also like to focus also on practices that activate the parasympathetic nervous system. So things like meditation, even yin meditation, all of those things, restorative meditation, those things really, restorative yoga, those things help tremendously to get the body more acclimated to being in this space, in this parasympathetic space. Many of us are living in fight or flight. We are living in the dominance of cortisol, and our bodies are never getting a chance to recover and to regenerate. So when you're in that state of sympathetic dominance for so long, it is very difficult to heal. And we have to work to kind of retrain ourselves, even force ourselves to get into that state. I find that people who are type A, or people who are used to being in that state, they find it very uncomfortable to sit, to do slow breathing, relax. It actually creates anxiety, but we have to kind of get over that hump and really train ourselves to have that resilience to go back and forth.
I really like what you're talking about. Exercise, meditation, trying to find that little space during the day for ourselves. There was also a word that you touched on, Dr. Dladla, which was hormones. I would
Yeah.
love for you to dive into all things hormones.
Yes, of course. So I love working with with people regarding hormones. I'm working with women and men, and we do a variety of hormonal delivery. So we do pellets, we work with injections, creams, patches in some cases. So we do a variety of things. And I think it's very, very important. Hormonal health is something that has been overlooked. Women have been ignored, and just basically told just to go home and just deal with it for many, many years. Unfortunately, due to a particular study that came out that really impacted the medical field and their perception of hormonal therapy. Now, over the years, that has been gradually debunked. There were flaws found in that study, but it's still something that is not front and center for a lot of practitioners. But I do not think that women should be subjected to just a life of suffering a variety of symptoms when there are ways that it can be addressed and handled, and it's just not being dealt with. So, I, for myself, as somebody in her 50s, found it really, really helpful when I started using hormones. It completely changed my energy level, in particular testosterone, my energy level. It changed my mindset, my ability also to be able to follow through. It had so many benefits. And when you start actually testing women and men, you find that their testosterone is often quite low. And with making this adjustment, adding the testosterone in a dose appropriate manner for that particular client, it's has a dramatic difference in people's quality of life. So all the benefits, right, of hormonal balancing, it's anti-aging. It can prevent chronic disease. There are so many benefits, and it should be something that is incorporated into just regular ordinary care. It's not. But when patients come to see me, we definitely address what are their hormonal imbalances, and we focus on that and give them a customized plan to rejuvenate themselves. And so you see that people's mood improves. Their not only their mood, but just the way that they are looking at their future lives. What can I do? What are the possibilities for me? Because when you're having all these physical symptoms of extreme fatigue, hot flashes, variety of things, your world can really narrow, and you can just feel like, I can't do much. I'm just trying to get through the day, and that's about it. So getting the body, getting the physiology kind of back into balance makes a huge difference in just the trajectory also of your life. So we definitely we do that, and we love to work in with a variety of modalities. So one thing we do also often before we even start using hormones, is we want to check to see what's happening with your microbiome. We want to optimize what's happening in your gut, because if there is a lot of dysregulation, if the quote unquote bad bacteria has completely taken over, if you have these symptoms of, say, leaky gut, that is going to also impact the efficacy of the hormones that we are going to give you. So really doing an investigation of the microbiome, getting rid of anything that's creating like a low level inflammatory response. That is something that we start with, and then after we give our particular protocol for the gut, then we'll start with the hormones. And it has been life changing, for women and for men.
You touched on so many good things. And I love the caveat that you said about looking at gut health, because I've interviewed well over 25 or 30 people all about hormones. And sometimes we get so deep into the weeds. And then at the end, they say, oh, yeah, by the way, hormones may not work for you if you don't have your diet on point. So I think that's a really key differentiator. But what I wanted to go back to is, What are the symptoms of low
Oh,
testosterone?
one of the main symptoms is fatigue and just low vitality. Also, it could be low libido, but fatigue seems to be one of the overwhelming symptoms. Just also feeling like you've made a plan and you just cannot get that plan to the finish line. Now, there are so many things that can cause fatigue. You can have, like a disruption in your HPA axis, which people call adrenal fatigue, and those things can also be a factor. So those things have to be looked at as well when you're looking at the variety of the hormones and looking to see if there's balance or imbalance. But that's one of the main symptoms. Of course, like for estrogen deficiency, you can have the hot flashes, you can have the dryness, vaginal dryness, your skin being dry, um, mood swings, brain fog, which is huge, and a lot of people complain about just feeling like they're just walking through a hazy maze, and it really affects their work and their ability to kind of carry out their normal duties. So those are the main symptoms. What we find is when you do replenish with hormones, it really helps to address those symptoms. It is anti-aging. The other thing interesting for menopause, a lot of women who are in menopause do develop sleep apnea and don't even know it. There is a link where that estrogen decline can impact your ability to continuously breathe throughout the night. And most of the time, that link has not really been kind of picked up on. But I have a lot of patients who have found that now they're beginning to snore. Someone has told them that they've stopped breathing in the middle of the night. They never had that before. So that is something that people should be aware of during the time of menopause and andropause is the sleep apnea.
That's a good point because if we're not sleeping well, it's probably going to make us more fatigued and moody and
Exactly.
maybe not interested in sex.
Exactly.
You mentioned a few different modalities, pills, creams, patches. What is the most efficacious form of taking testosterone?
So a lot of it has to do, I think, with patient preference and what they feel that they're able to actually do. So I find that all of the different forms that we use can be very, very helpful. It just depends on you. So for example, when we use the creams are usually applied daily. And the good thing about the creams is that you can adjust it. So you can find what the right dose is, and then we can continue on using that dose. So you have a lot more control. The downside of the creams is that you have to put a cream on yourself every single day. Some people don't like that. It goes on your can go on your clothes. If you're living with somebody, you have to make sure you don't touch that person because it may transfer over. So people don't like that aspect of it. But if you're somebody who's quite, sensitive and you don't know how you're going to react, sometimes the cream is really a great way to start. Um, I prefer the pellets. I like the pellets. I think they're more convenient for people who are looking for something where they don't have to use like a messy cream or do any kind of big injections. The pellets are a great option. You can do them every few months. The downside with pellets though is that once I have that dose in your system, I cannot make changes. I have to wait for a period of time to be able to make that shift. But I find that people really, in general, really respond well to the pellets. We do it on a weight-based, calculation that we do. And I find that people are much happier not having to worry about using messy creams.
That's nice. And what's the lab range you're looking at for females? Is it total, free, both?
Yeah, so it's both. And I do, I want to see, I actually go a lot by people's symptoms. because I don't want to only go through a lab value. Usually, when we're using pellets and we're using creams, like we're looking for a higher level of testosterone for women. Often, if they go to their strictly conventional doctor, they'd be like, "What is this? This is way too high. What's going on here?" So, so we do a combination of, we do lab work, obviously, but we're also looking to see how that person, is responding in terms of their symptoms. I also, around that, like to also get a good history of their cardiovascular risk and profile to make sure, like, if somebody does have underlying coronary artery disease, that we're actually, going to be following up and making sure that we're not exacerbating a situation. Although, it's like things can go in both directions. So having a balanced testosterone can be very, very, very helpful in preventing cardiovascular disease. But if it's too high, it can also exacerbate. So we work with the patient, their family history, everything is kind of customized for them. But we do the testosterone levels and the other hormone levels like on a regular basis as we change the treatments.
For a female with free testosterone, would you look for
Mhm.
somewhere between 7 and 20?
Yeah, I would say that usually like around, 8, 9 is what I'm looking for. I go back to how they feel because I have some people whose numbers are really perfect, but then they're saying, "Oh, I feel very agitated. Oh, I'm getting much, much more hair quicker than I want." Now, for me, I think, listen, having excessive hair is a small price to pay if you can feel so much better in so many ways. And there are ways to address the excessive hair.
Right? Get some
So
tweezers, get some laser hair removal. It's not that bad.
exactly. And everybody's different. Doesn't mean because some people were, "Oh my God, am I gonna have a bushel of hair?" Not necessarily. It depends where you apply the cream. Yes, you're gonna have a lot of like local hair growth, but you can shave it. There are things that you can do. You really have to weigh your own health and the quality of your life versus having that excessive hair. So.
Yes. Yes. Okay. Now I know we're all an N of one. This is what I'm gathering from you that you want to take someone's full history and symptoms into account before you treat them. But I'm wondering, as a general practice, which hormone
Mhm.
will you start someone on first?
I usually like to start with testosterone and then we start to add, then the next round we do both. We add the estrogen and we add the testosterone. And I only like to do that because I want to see how they're going to respond and if there's any issues, if I need to go back, scale back on, lower the dose of the pellet, and then I'll add. There are some people who we do it all together. We do it all together. But I like to do it if the patient agrees with the testosterone first, because I usually find that to be very, very low, and they seem to feel significantly better pretty quickly. Once we have all those hormones balanced, the estrogen, the testosterone, there's a huge difference. I give pregnenolone as well. That makes people, it helps them tremendously with fatigue. I use low dose naltrexone if they have any autoimmune or really severe fatigue issues. We definitely try to focus on kind of cellular regeneration, kind of, we aim at the mitochondria, trying to build up the efficacy of the mitochondrial function. And I do it stepwise. Like I have some patients who are quite sensitive. So starting with just one is preferable so I can monitor and see how I need to adjust.
So you're not just throwing the whole kitchen sink at it.
No, no. Eventually, we're going to start to add, add multiple things, but I think it's better because some people who personalities get very anxious, and I don't want them
Mm.
to be like, what is causing what? Even with the creams, ideally it's really more convenient to kind of add the creams together, the different hormones, but for some people that just does not work. And you have to separate everything out and let that person adjust based on how they feel.
What are the symptoms of low estrogen?
Yeah, very similar. There's a lot of overlap. the dryness, the vaginal dryness, the skin dryness, and the brain fog. I find the brain fog is kind of huge. Also, you start to age very rapidly without the estrogen. So, um, giving estrogen makes a huge, huge difference in terms of your immune system, your vitality, your cellular aging, everything. So I love to do that. I love to work with also, like I was mentioning about the gut health. Um, I also use different modes of cellular regeneration as well if patients are looking for that. And then you can really make a fully like comprehensive program for people where you're addressing every issue, their hormones, their gut health, weight optimization, and then the actual cellular integrity.
Which form of estrogen do you prefer?
So I give biased. I usually start pretty much on the conservative side, and then I dose up accordingly depending on the person's weight, their symptoms, and how they respond. So we do a combination, do low dose. I also do oral progesterone as well, and that really helps because it's very important that you have the progesterone in there as well. It's interesting for some people. I found that with the oral progesterone, it did not respond as well, and we had to give them also the progesterone in the cream form. So I like to do both. The oral progesterone is really giving you that uterine protection, uterine lining protection. So it's really important. But in terms of symptoms, you want to also, the person should be feeling good. So if I have to do a combination of some cream, oral, I'll do that. I'll make that concoction based on kind of what their symptoms are. But we do use bias.
And then you had mentioned progesterone. What
Mhm.
does progesterone do?
Oh, it has many functions. Also, it helps to regulate the circadian rhythm. It is helping also with anti-aging, with cellular integrity, gut health. It has a lot of benefits, but when we use it in also in the context of the bioidentical hormones, we do it to protect the lining of the uterus, and we also monitor that as well. Either they go to the GYN, and they will do a transvaginal ultrasound, so we can make sure there's no abnormal thickening of the lining. Um, but progesterone helps also significantly with relaxation, with sleep. A lot of times, one of the symptoms when you're going through menopause or perimenopause is your sleep becomes completely wacky and messed up. And so the progesterone helps people to get a good night's sleep, which is very, very important for everything.
You had also mentioned low dose naltrexone. What would you use
Mhm.
that for?
So I've used that for people who had what I had, which was the Epstein-Barr reactivation, which can be called chronic fatigue syndrome. I've used that for that, as well as any autoimmune condition. I can use it for. It helps to balance the immune system, increase and improve the efficiency of the immune system. It's overall, I still use it, and I find it to be a very good adjunct to other therapies and things that I'm doing. Um, I think if you think about inflammation, right? Inflammation is really the foundation for every problem that we have in the body. Anything we can do to reduce and decrease our inflammation is really critical. And I think that the low dose naltrexone is very helpful in conjunction with other things as well.
Ooh, okay. I like the sound of that and lowering
Yeah.
inflammation. What are these other
Yes.
things you speak of?
hmm So in terms of, so we use red light therapy. So we do red light therapy treatments that it has a very profound effect on decreasing inflammation. We use the PEMF mat, which also helps to relax the nervous system and allow for healing and to also decrease inflammation. hormonal therapy, that we're using weight optimization. For example, we're using various peptides. Um, One is the semaglutide. The semaglutide can be used, you can microdose that just to decrease the inflammation in the body. I've seen amazing things with semaglutide for people who had weight issues, but had also, say, severe eczema or had allergies, variety of skin conditions. All those things kind of quieted and calmed down in their system when they were given that particular peptide. Also, you can't overlook things like your diet, right? Your lifestyle. So the diet plays a huge role. It'll increase sugar, processed foods, all of those things that we're ingesting really can drive up these inflammatory markers in the body.
Okay, I have a two-part question. Do you
Yeah.
use anti-aging peptides? And if so, which ones are they?
We do use peptides, but we also use other cellular products, stem cells, exosomes for people who are really looking to take it to the next level. And that really has a huge, huge impact, particularly the exosomes, on a person's inflammatory response and really activating the body's ability to regenerate, to heal, to repair. So that's become a really big part of our practice, and that's just going to expand because people really see systemic, amazing effects on their body with the help of the exosomes and the stem cells.
Mhm.
The peptides we do use, I use a lot of BP 157, for example. We use that. Um, Somorelin. We do a variety of peptides. But what I like to do is do like a customized program using all of these different modalities to take people really to the next point. And I find that it's not going to be just one thing. You're going to have to do multiple things to get people where they need to be. For example, if someone is not eating right and they're using peptides, nutraceuticals, all of these modalities, they're going to have a temporary effect, but it's not going to be where they want to go. Everything kind of has to be kind of dialed in. And that all starts really with your mindset and the way that you look at your health and the way you think you can impact your energetic field, right? By already feeling and knowing that you are in that state of health that you want to be, not wishing for it, but knowing that you're there.
Dr. Dladla, what are the top three reasons people come to see you?
The top three reasons: hormonal imbalance. I have a lot of women in menopause and men in andropause who are desperate to figure out what to do. That's the number one reason. The other reason is the cellular regeneration that I was talking to you about. So people who are looking for a anti-aging solution that will have long-term impact. I have people who are in their 80s, never been on medication before, have grandkids, and want to live as long as they can in the best possible cognitive physical state. And they are using whatever tools they can to make that happen. I also have people who are, professionals, athletes who are just trying to optimize their game in life, basically, or also their physical game. And the cellular regeneration makes a huge, huge impact and difference in doing that. And I also have people who are looking for cardiovascular help. So I have a integrative cardiovascular program looking at trying to diagnose people with CAD, coronary artery disease, or arterial disease, to prevent it, and if they have it, to make sure they do not have an event because of that. And we use a range of modalities, including nutraceuticals, diet, lifestyle, medications if necessary, imaging such as Clearly, variety of things to really focus and aggressively deal with arterial health. It's one of the main issues for women, particularly when they go through menopause, and it's often overlooked and not diagnosed until someone has an event.
What can we do for our arterial health so we don't end up in a deleterious situation?
The first thing is to get yourself screened, even like in your 40s. And the way that I usually do that is through a coronary calcium score, which is an imaging study. And that's a very important test because you can see if you have any plaque in your arteries. And that's a very good starting place. Many of us have plaque, but it's asymptomatic. We have no idea and we don't feel anything. So that is really critical. There's also a variety of blood work that I can do to see if you have any underlying inflammatory markers, any genetic factors that may predispose you, even though you don't know and you feel great. That's very important to get a handle on that as well. The lifestyle really is kind of the same. So first is the gut health, actually. Leaky gut can be an underlying precipitator of cardiovascular disease. So, learning about your microbiome, fixing your microbiome, preventing leaky gut, or healing leaky gut is really, really critical for your cardiovascular health. Exercise, cold therapy, red light therapy, intermittent fasting is also very, very helpful, particularly if you can do it, not every day, but maybe 4 days a week to give your body that variability and that resilience to be able to go back and forth between different states. All of those things help cardiovascular health. But the main thing is to actually investigate to see where you stand because many of us have no idea that we do have coronary artery disease. I've even had patients who were athletes with, very aggressive diets and very, very positive lifestyle to find out that no, they do have inflammation, they have arterial disease. So it's something that we should advocate for ourselves to get that testing done, or you can come and see me and I will just do that as part of my protocols.
Oh, can you name that test again? The
Oh,
calcium.
sure. Yeah, so it's the coronary calcium score testing.
And is that one of the best tests? That's like one of the ones that we should do every year, no matter what?
That's a good place to start. That's like a starting test. So when you do that, based on the results, what you'd want to do, depending on what I see, we would do that every few years. So we don't do that yearly, but you want to get a baseline. And because people are under such duress, they have so much stress, people are getting sicker earlier. So it's good to do that, particularly if you have a family history of heart attacks, strokes, which many people do have. It's very important to have that done.
It sounds like you're looking at the whole person.
Absolutely. Absolutely. Yeah, everything kind of fits together. And this is one of the reasons why I went into longevity, integrative medicine, is because you don't want to kind of disregard one aspect. You want to look at all the things together. You want to have a focal point, but you have to recognize that everything is kind of, interwoven. And you want to kind of parse that out and do things step by step so people can get the best result.
What does it look like when someone comes to see you for their first appointment?
For the first appointment, I give you a fairly large packet to complete, going through your history, going through also what your main health priorities and concerns are, your family history, any emotional issues that have impacted you. I'd ask about your dental health because that also has an impact on your cardiovascular health. It's a very in-depth kind of questionnaire. And then once I have that questionnaire and then I meet with you, we can kind of focus in on what your priority is for your health. That discussion can be anywhere from 45 minutes, hour to an hour and a half, depending on the case. And from there, I'll do a variety of testing. So I do variety of scans, like energetic scans, to see how your body is regulating, what things are most out of balance. I'll correlate that to what you've told me your concern is and also your history, which will give me a really good idea of where to focus. But I'll correlate that and then we will come up with a plan of how we're going to achieve what we're going to achieve. And we're going to do that in parts. And I really like to be able to have different tools, right? So for my cardiovascular program, if I need to use medication, I will use medication, but it depends. Really, it's very customized based on the person. And if I have to give particularly a medication, say a statin, if I have to give a statin, I will give things to mitigate the negative effects of that statin. So there are, it's a whole picture, and we're using everything in our toolbox. We're also using what the client is going to lead forward with and what's going to be most efficacious. So I'm going to give you the whole picture, and then we work together to find the best solution for you.
What would you recommend if someone needed statins?
So one of the things that I do give, because I do have people who really do not want to be on a statin, and I understand that. So I give things to help with the mitochondria, because one of the things is the statins can target and deplete the mitochondria. So I will give a mitochondrial supplement. Also, for example, the statin can affect your CoQ10 cycle. So I'll give CoQ10 to help replenish the CoQ10 cycle. We would always start usually with a low dose if we have to go there. And I really only go there if I see something very significant on that coronary calcium score test. I do not just blanketly offer that if people have high cholesterol, because you can have people who are high cholesterol producers but have no arterial disease. Everybody is different. But those two things are really, really important if I do have to go there with the statin. I also have a supplement that I use called arterial sol, and I give that for people who refuse that statin. And that does help to resorb some of the plaque or the cholesterol that people might have. So that's a discussion that we have if we need to.
All right, Dr. Dladla, it has been a pleasure speaking with you. And as we wrap up this podcast, I ask all my guests the same closing question, which is, what haven't I asked you that you'd like my listeners to know?
Well, I'd like your audience to know that we really, we do care about the underlying person. This is a journey. It's a health journey. There is actually more to you though than your body. So this is one aspect, and our job is to do whatever we can to optimize your body. But we care, and really, it's like a close-knit family here, where we really try to work with you to get the best results. And that is, we are concerned about what's happening to you personally, but also your energy field. We do a lot of work with that as well, working with the chakras and a variety of modalities to help people to balance their energies. So we're here, we're caring, we're taking new patients. We'd love to see you. We're on Lexington, 22nd Street in Manhattan, and we'd love to work with you.
That was going to be my last question. Please tell listeners where they can go to find you and more about you.
Yeah. So my website is GramercyParkIntegrative.com.
We'll make sure to put that in the show notes. Thank you so much for your time today.
Yeah.
Thank you so much for listening today. A quick shout out on Instagram or sharing this podcast with a friend can make a positive difference. If you're listening on Spotify, Apple Podcasts, or watching on YouTube, a great way to support the show is by leaving me a review. You can also support my work by using any of the affiliate links in my show notes or by visiting my website, ashleydeeley.com. This podcast is presented for educational and exploratory purposes only. The published content is not intended to be used for diagnosing or treating any illnesses, diseases, or disorders. Those responsible for this show disclaim any responsibility for any possible adverse effects from the use of this information presented by myself or my guests. Please consult with your healthcare provider before using any products or services referenced in this podcast. The content here is for informational purposes only. Episodes on the Welcome to Wellness podcast may at times cover sensitive topics, including but not limited to depression, suicide, 5G, nootropics, circumcision, birth control, the Women's Health Initiative, the use of plants medicine, abortion, geoengineering, terrorism, gender, AI, sex, drugs, and rock and roll. You are advised to refrain from listening to this podcast if you are likely to be offended or adversely impacted by any of these topics. However, if these topics interest you, you just may have found your tribe. The information or opinions expressed on the Welcome to Wellness show are solely the views of the individuals involved and by no means represent absolute facts. Opinions expressed by the host and the guests can change at any time. The views of my guests are solely their views, and the Welcome to Wellness show does not accept responsibility for them. Any action you take based on the information contained within this show is strictly at your own risk. The Welcome to Wellness host, Ashley Deeley, will not be liable for any losses or damages in connection with the use of this podcast. You should take all necessary steps to ascertain the information you receive in this podcast is correct and has been verified. None of the guests or contributors on the Welcome to Wellness podcast will be responsible for your use of the information contained therein. Under no circumstances will the Welcome to Wellness show or my affiliates, partners, suppliers, licenses, or guests appearing on the show be liable for any direct or indirect consequences or damages arising from your ability or inability to access this podcast. All intellectual property rights belong to me, Ashley Deeley, and include, but are not limited to, the copyright and any other rights in the design. You are permitted to use the Welcome to Wellness podcast for personal use, but not commercial use without a license. You may not make recordings. If you breach these terms, you lose the right to access the Welcome to Wellness podcast, and you must destroy or return any copies of the recordings you've made. Guests on the Welcome to Wellness podcast may at times provide information on or read extracts from third-party copyrighted work. The Welcome to Wellness podcast does not provide any medical or professional advice within these episodes. If you take any action or inaction as a result of the content you consume from the Welcome to Wellness podcast, this is based solely on your decision, and the Welcome to Wellness podcast, Ashley Deeley, and my guests cannot be held responsible or liable for any of the consequences of such action or inaction. Thank you for listening.